Yeah, thank you for invitation, and also I'm glad to be here with you today. So I was given only 8 minutes to present this very important topic, and so buckle up and bear with me because I'm going to be a bit fast. So if you think about artificial intelligence, it is everywhere around us, in our mobile, in our cars, in our home. So it is there, and we are living around, it is living around us. The problem with the AI in healthcare, it has been a bit slow adopting AI in healthcare. You can see here the job openings in US between 2015 2018. You can see that the jobs requiring AI in healthcare is at the bottom of the list. This has changed a bit recently. As you can see here, there is a tremendous increase in the interest of artificial intelligence and machine learning in healthcare starting in the last 10 years. I can see that there are two major areas where AI can help us in cardiac imaging as a whole, or in healthcare as a whole, and in cardiac CT. Areas where we can do, but we are a bit slow and we are overwhelmed, so we can ask the AI to help us to make our work more efficient, like examples: coronary calcium scoring, coronary segmentation, severity assessment, and also CT for structural heart disease. Or there are areas that we cannot do very well, like image enhancement or CT-FFR. So those are all computer-based and artificial intelligence-based algorithms. Those are the potential uses of AI and cardiac CT, from the patient selection and scheduling to the follow-up and assessment of the risk. And in between also our work, which is CT images acquisition and analysis. This is one of the examples of a very interesting role of AI in cardiac CT, where we have a very noisy image, as you can see here, because we are trying to reduce radiation in cardiac CT. So we end up doing some noisy imaging like this. We can ask the AI to improve the image quality and give us an image quality like this, which is similar to high-dose CT. The other example of image enhancement algorithm that we use AI for is the motion correction. You can see from the right top image here in the axial image that the right coronary artery has a motion artifact there. And this is common sometimes if the heart rate is irregular or fast. But with the AI, we can correct this motion, and you can also appreciate this in the long axis of the right coronary artery, where you can see a motion artifact that has been completely corrected. I'm not going into details how do we do that. It takes a lot of time to explain this. The other areas where AI can help us in the automated coronary artery calcium score calculation. Like conventionally, the CT can recognize calcium and non-calcium, but we need more like an intervention from our side where we can circle the calcium and we name the vessel. With the AI now, we don't have to do that. It is done all automated. So the AI algorithm will detect the calcium and also will detect the area of the calcium and label it by the segment, whether it is LAD or RCA. But we have just to make sure that this is not perfect yet, and there are some false positive calcium lesions, either from pericardium or from the aorta or from other areas. Automated coronary artery segmentation is a bit more complicated, but much more useful. Started with asking AI to help us to recognize coronary arteries, just to recognize that this is coronary, this is non-coronary. I'm not yet here saying that this is LAD or not LAD. Then after we recognize those are coronaries, then we ask the AI, now name the segments of the coronary arteries. This is the LAD, this is diagonal, this is RCA, and the AI could do that. Then we say we need more, so I need the AI to help me to say that this is a severe lesion, not severe lesion. And if it is not severe lesion, it is ischemic or non-ischemic. And also we can see if there is any inflammatory inflammation around the vessel, which is important. This is one example of our cases that we can see. For example, this is the XL images where you can see everything is either black and white, but with the artificial intelligence, we can see that the computer already segmented the coronaries and non-coronaries. And we can also appreciate this in the 3D here. You can see that the coronaries are given red color. And also one step ahead, that we can see that the AI already labeled the coronaries. And I click on the coronary and the name is appearing there. So how good is the AI to detect and also to assess severity of coronary artery disease? This is a big study comparing AI to a level 3 reader from a labeled data. So the good truth here is a level 3 imaging, a core lab imaging from confirmed registry. And as you can see here, we went through the training and testing and everything, and you can appreciate that the AI has correctly labeled identify the coronaries, label it, and also detect the coronary artery disease severity. And compared to the level 3 reader, AI did very well. Very good agreement between the AI and level 3 readers. The other one is the automated coronary segmentation, which using also the CT-FFR, where we can see there is some lesions that we need to know if they are ischemic or not. And this is a computational fluid dynamic, depending on the contrast and resistance of the lesion. And just comparing, if we want to do CT and we found a lesion, we are not sure about ischemia or not, either to do SPECT or to do, for example, PET, or to do CT-FFR. And CT-FFR showed very well discrimination of ischemic or non-ischemic lesion, almost as compared as PET, and better than SPECT. But the cost is the problem with the CT-FFR, and this is from a review of data from the UK, a large review, and showed that at least that the CT-FFR is more expensive than SPECT and CMR stress. We can do the same for structural heart disease, and this is just one example of Philips algorithm or the module to assist for TAVI, and you can see here, just by a click of a button, everything is segmented from the LV to the aortic root. And also we have the computer will show us the important anatomical landmarks, like, for example, like coronaries or the annulus. And after accepting all this, the computer will give us all the measurements automatically from the LVOT to the annulus to the coronaries to everything. And this can apply also to the mitral and tricuspid and pulmonary. As you can see, sorry, I'm going a bit fast. So as you can see that there are a lot of data that we can get from cardiac CT. I have only 1 or 2 minutes to finish. So this is the data that we can get from CT coronaries. A lot of data, not practical for a day-to-day use to report all these data. So what is my, and there is limitation almost of access and training duration for the imagers is long post-processing and long time waiting for the patient. We cannot use a shortcut. We cannot ask non-expert people to, or less expert people to report all these things. And this is from a core lab interpretation and also comparing to hospital interpretation. They found that those less experienced reader, they overestimate the severity of coronary artery disease. So this is the area where I can see that the AI can help us. So I will take a little bit 1 minute on this, because this is my view, how can AI help us? If I am the expert reader, or you are the expert reader, and this is your hospital, so everything is under your control. Your technology is under your control, and your trainee is under your control. So you can improve the image quality and ask your trainee to do all the work for you, and then you validate, and then you do a report. Or you can use, again, the AI to make image enhancement, coronary artery calcium scoring segmentation, and coronary artery severity, and then you can also validate and do. And by this, you almost increase the number of trainees that you are having, and even not a trainee is a level 3 expert with you reading. So it's just you to validate. So this is increasing the number. But another way is for remote hospitals, and this is where virtual hospital can work. We have multiple hospitals where there are no experts, either no experts in acquisition, not expert in selection, or no expert in even the reading. So the AI becomes much more important in this area, where we can use the AI for patient selection, making appropriate indication, scheduling, image acquisition, which protocol, which radiation, which parameters in the CT, and also the reconstruction. And then we ask the AI also to do preliminary for us the coronary artery calcification and coronary artery severity calculation automated. And the AI can also flag the cases that have, for example, severe coronary artery disease, and then can be sent to the expert reader virtually, say, Saha Virtual Hospital, and those flagged cases can be reported first, and then the normal can be reported later. And this way we can improve our efficiency either at the local hospital or remotely. I think by this I concluded my talk, and thank you for your attention.